different size of cups. This is vacuum extraction. Extractor, and this delivery is called vacuum extraction delivery or Ventouse. So it is a traction of fetal head by a created negative pressure through a cup applied to the head. Same as it is made in one picture, 3 Idiot. The Amir Khan made that cup, that is actually a type of Ventouse which he was created. The instrumental device designed to assist delivery by applying traction to a suction cup attached to the fetal scalp. Any condition threatened to mother or fetus that is likely to be related by delivery, and fetus is at least 34 weeks in gestation. So what about vacuum extractor? It is composed of a specially designed cup with a diameter of 3, 4, 5 and 6 centimeters. Then a rubber tube is attached to the cup to a glass bottle with a screw in between to release the negative pressure. Then a manometer fitted in the mouth of glass bottle to declare the negative pressure. Another rubber tube connected to the bottle to a suction piece which may be manual or electronic created negative pressure that should not exceed 0.8 kg per centimeter square. The indications for vacuum delivery are it is an alternative for forceps delivery. In cases of occipital transverse or posterior position, delay in descent of head in cases of second baby of twins, delay in late first stage of labor. During C-section, it may be used to extract the fetal head through the uterine incision. Maternal indications are maternal distress, exhaustion after a long painful labor due to insufficient uterine contraction, prolonged second stage of labor. In nullipara, if it is more than 3 hours with regional anesthesia and more than 2 hours without regional anesthesia. Like in Paris women, if it is more than 2 hours with regional anesthesia and more than 1 hour without regional anesthesia, this may be a candidate for application of Ventouse. Maternal medical disorders such as heart disease, hypertensive disorder, moderate to severe anemia. Previous cesarean section or genital prolapse repair, and intrapartum infection, certain neurological condition, we can apply Ventouse. Fetal indications are collapse of umbilical cord, premature separation of placenta, non-reassessing fetal heart rate pattern, that means irregular fetal heart rate, and fetal distress, non-rotated head or occipital transverse position, and occipital posterior position. Types of cup, we have main difference between vacuum extraction lies in the cup. In Malmstrom cup, a metal cup to its center attached to a metal chain pass through a rubber tube, and other end of chain is attached to the handle for the traction. Second type is bird's cup. The suction rubber tube is attached to the periphery of the cup, while the handle of the traction is attached by a separate short metal chain to the center of the cup. And third one is soft cup, which we usually used. It is a bell-shaped 6.5 cm diameter soft cup which is made of a firm but supple elastic material. Contraindications for its use are moderate to severe cephalopelvic disproportion, other presentation than vertex, premature infants, intact membranes, suspected fetal coagulation disorders, and fetal macrosomia. Conditions to be fulfilled before application of Ventouse are: should not be slightest bony resistance below the head. The head of a singleton baby should be engaged, and cervix should be at least 6 cm dilated. In forceps, as I told you, cervix should be 10 cm or fully dilated. In this case, the cervix is not dilated, so you can applying Ventouse in cases of 6 cm dilatation of cervix. Now the procedure. Patient should be in lithotomy position. All aseptic measures for the vagina, vulva and the perineum. A general examination to be done to check pelvic capacity, cervical dilatation, presentation, position, station, and degree of flexion of head and that of membranes are ruptured or not. Same as forceps application. Then application of cup, a largest cup that can easily pass it introduced sideways into the vagina by pressing it backwards against the perineum. It is then applied as near as possible to the posterior fontanelle over the mid-sagittal line with its areas 3 cm from the anterior fontanelle. This position will promote flexion of the head and brings the smallest diameter of fetal skull into the maternal passage. Be sure there is no cervical or vaginal tissue, nor the umbilical cord or a limb in complex presentation. It's included in the cup. So you should be very vigilant to applying cup in the head. This is the picture how to and where to apply. Okay. Like this, the posterior fontanelle cup is applied, and this one is the correct position. This is anterior fontanelle, this is posterior fontanelle. So we have to apply the cup near the posterior fontanelle, covering the mid-sagittal sutures 3 cm on the both sides. And these are the incorrect position, like here in between the sagittal suture but near to the anterior fontanelle, and this one. So these are the incorrect position, and this position is correct and this position is correct. Again, for the view, this is the cup, this one is tube, and this soft cup, and this one is manometer, and this is attached to the bottom. Now the application of vacuum cup is here in the posterior fontanelle in the mid-sagittal suture, and this one is the elastic vacuum cup with attachment of metal screw. Again, same picture. This is the right position. This position of cup, 2 to 3 centimeters, occupying the mid-sagittal suture. This is posterior fontanelle. This is anterior fontanelle in transverse view, so that it creates more flexion of the head towards the neck. So head is more flexed, and that leads to easily delivery of the fetal head. Now, creating the negative pressure, handle the cup in the place. The negative pressure is gradually increased by 0.2 kg per centimeter square every minute until 0.8 kg per meter square is attained. This created an artificial caput within the cup. Then traction on the handle is made perpendicular to the cup and intermittently during uterine contractions. The direction of pull changes as the head descends in the canal. After delivery of the head, the release of the cup should be done. When the head is delivered, the vacuum is reduced as slowly as it was created. Using the screw as the diminishes the risk of scalp damage. If you suddenly release the cup, that leads to damage to the scalp. Bird safety rules for vacuum extraction is the head must be completely or partially delivered with not more than 3 pulls. So you can apply only 3 pulls. The head is at least begin to move with the first pull. The cup must not be applied more than twice. Application of the cup must not exceed 20 minutes. That means after application you have to deliver the head within 20 minutes. This is the picture showing after delivery of the fetal head. You can see there is a red mark over there, that is because of formation of caput. Complications which can occur because of Ventouse are maternal complication, soft tissue injuries such as cervical tear, annular Detachment of cervix, vaginal tear, perineal laceration and tear, extension of episiotomy, vaginal wall and perineal hematomas, traumatic postpartum hemorrhage, infection, genital prolapse, cervical incompetence, and maybe future prolapse used with incompetency in incompletely dilated cervix. That means less than 6 centimeters. Fetal complications are scalp laceration and bruising, hematomas, cephalohematomas, subclavian hematomas, intracranial hemorrhage, intraventricular and cerebral hemorrhages that leads to fetal death, retinal and subconjunctival hemorrhages, neonatal jaundice, clavicular fracture, shoulder dystocia, injury to cervical 6th and 7th nerve, and Erb's palsy. Hypoxia, particularly when the extraction has taken a long time and has been difficult. And lastly, fetal death. Advantage of vacuum over forceps, that is very important to know. Anesthesia is not required, so it is preferred in cardiac and pulmonary patients. Ventouse is not occupying a space besides the head as forceps. Less compression force, it is 0.77 kg per meter square compared to the forceps, that is 1.3 kg per centimeter square. And the maximum force in Ventouse is 0.8. So injury to the head is less common in Ventouse. Less genital traction laceration can be applied before full cervical dilatation. It can be applied on non-engaged head. Disadvantages are required maternal effort, equipment more complex and may fail time in fetal distress, cannot be used in preterm, and sometimes there is more cephalic hematomas. In cases you can use. Now management, to assess the effect on mother and the fetus, we have to start a wrinkle solution drip to arrange for the blood transfusion if required. That means after delivery you have to examine her again, her blood pressure, pulse, blood pressure. There may be a PPH, so we have to exclude the rupture of the uterus, and you have to examine thoroughly after application of Ventouse or forceps. Assess procedure is to be abundant and consider delivered by cesarean section. That means if 3 pulls the baby head is not delivered out, then go for C-section. Laparotomy should be done in cases of rupture. Sometimes there may be rupture of uterus because of pull of the head and then delivery of the baby. That may lead to rupture of the uterus. So you have to thoroughly examine after delivery, and if there is, you can diagnose, then go for laparotomy. And again, if any infection, any more bleeding is there, we have to administer parenteral antibiotics to prevent bacterial infection and sepsis and death. That's all for Ventouse. So the topic of forceps and Ventouse are covered, and I will give the list of 8 semester topics that you have to study all this. And then next class we will start from 9 semester topics that should be covered in between. Right, that's all. Bye.